So patient is going to be sitting with the arm adapted, elbow extended, and forearm supinated. I'm going to be stabilizing the humerus, proximal, distal to the humerus, proximal to the elbow. I'm going to be palpating, observing and palpating the biceps with 2 fingers. So observing and palpating the biceps with 2 fingers. I'm going to stabilize the humerus, and then I'm going to ask the patient, Mr. Diego, can you please do this movement for me? Flex your arm and now extend your arm. Very good. So that will be 3 out of 5. Alright, Mr. Diego, now I'm going to be applying some resistance to the distal part of your arm. Please don't let me push you down. Just be as strong as you can, okay?
Okay.
So, can you please bring your hand to your shoulder again? And don't let me push you down. I'm going to be applying some resistance at the distal part of the forearm, in the volar part, while I stabilize the humerus. Sorry, hold on one second. Alright, so I'm going to be pulling down. Don't let me break you. 3 plus, 4, 5. Alright, so that will be 5 out of 5. Now, I'm going to continue to ask you a few more steps. Now the patient is going to move against gravity. Is going to do the movement, but no full range of motion, but more than 50%. Alright, so patient is going to be with the same position, arm adducted, elbow flexed, forearm supinated. I'm going to stabilize the humerus. I'm going to observe and palpate the biceps. And now, Mr. Diego, can you please just do this movement for me? Right there. A little bit like this. Okay. So that will be Mr. Diego. Well, technically I'm asking him because he doesn't really know about this, but that will be 3 minus. Alright? Thank you. Alright, Mr. Diego, now I'm gonna ask you to move your arm. Okay? Try to touch your, I'm gonna stabilize here. Palpate the biceps, observe. Try to bring your hand to your shoulder. Alright, that's really 2 plus out of 5. So less than 50% range of motion. Against gravity, no resistance added. Now we're going to be checking you without gravity, alright, sir?
Yes.
So patient is going to be laying down on supine with the arm abducted and externally rotated, forearm in supination and elbow in extension. Alright, so I'm going to bend a little bit in here to be able to work with the client. I'm going to be stabilizing, I'm going to be stabilizing in the humerus, proximal to the distal from the shoulder, proximal to the elbow. I'm going to be observing and palpating for the biceps in here. Observing and palpating for the biceps. Sir, I'm going to ask you to please touch your shoulder. Bring all your hand up. Alright, so that will be 2 out of 5. Full range of motion, no gravity, no resistance. Alright, so now we're going to see if the patient can take a little bit more while laying on supine. Same position for the arm. I'm going to stabilize, observe and palpate for the biceps. Sir, can you please touch your shoulder? I'm going to try to push you down. Please don't let me. So I'm going to be pulling down while I stabilize in here. May I have a hat, okay? Alright, so may I have a hat, okay? Alright, so that will be 2 plus, minimal resistance with no gravity. Alright, so continue, arm abducted, same position. I'm going to stabilize distal to the shoulder, proximal to the elbow. Alright, so now let me continue checking, sir. Please try to check, touch your shoulder. So that's less than full range of motion, no gravity and no resistance. So that will be a 2 minus. Now vas a hacer así cuando te haga que todo eso, okay? So now, sir, try to touch your shoulder. That's a twitch, muscle twitch. So that will be 1 out of 5. Then todo flácido. And now I'm gonna check if this patient can do something. Can you please move your arm? Okay, so that's flaccid. The patient is flaccid, 0 out of 5. Alright, so now we're gonna be working in elbow extension. The patient is gonna be laying on prone. Sir, you're gonna be laying with your tummy down. Just relax. Patient is gonna be with the arm abducted at 90 degrees, elbow flex. Bend your elbow, please. Perpendicular to the floor in a neutral position, like this. Okay? Arm is gonna be perpendicular to the floor, neutral position. I'm gonna be observing and palpating for triceps. So I'm observing and I'm palpating for triceps. Alright? So, sir, can you look at me for a second? So what you're gonna be doing is I'm gonna guide you first. You're gonna bring your arm up like this and then down, okay? Okay, but relax. I'm gonna be stabilizing the humerus, proximal to the distal to the shoulder, proximal to the elbow, stabilizing, observing and palpating for the triceps. Alright, so sir, can you please lift your arm, extend your arm all the way up, and now bring it down. So that will be 3 out of 5. Alright, okay, now I'm gonna see if the patient can tolerate some resistance. Alright, so same thing, I'm gonna be stabilizing the humerus, distal to the shoulder, proximal to the elbow. I'm gonna be observing and palpating for the triceps. Sir, when you do the movement, don't let me push you down, okay? Can you please pick up your arm, lift your arm? Lift your arm, no. Okay, thank you. And now I'm going to be applying some resistance in the distal part of the arm. So don't let me push you down, sir, okay? So I'm going to be applying the resistance in the distal part of the arm, proximal to the wrist. Distal part of the elbow, proximal to the wrist. Okay, so 1, 2, 3. Don't let me break you down. Don't let me push you. 3 plus, 4, and 5. Alright, so 5 out of 5. Alright, so now we're going to be checking for 3 minus. Alright, I'm going to be doing the same process, stabilizing the humerus, proximal to the distal to the shoulder, proximal to the elbow. Sir, can you please try to lift your arm? So that's more than 50 but less than full range of motion. That would be 3 minus. So now we're going to be doing elbow extension but with no gravity, gravity eliminated. Okay, so now the patient is going to be laying down on prone. The arm is going to be abducted, externally rotated. Elbow is going to be flexed and the forearm is going to be supinated. Elbow is going to be flexed and forearm is going to be supinated. So now I'm going to be stabilizing the humerus, distal to the shoulder, proximal to the elbow. I'm going to be palpating for triceps. I'm going to stabilize. I'm going to palpate and observe for triceps right here while I'm stabilizing. I'm palpating more than actually observing it, but I can feel it. And now I'm going to ask the patient to see if he can extend the arm. Sir, can you please extend your arm? Or you're going to be doing this movement now.
Okay.
Okay, can you please bring your hand down? And then up. Okay, so extend your arm please, sir, all the way out. Extend. Alright, so that will be 2 out of 5. Gravity eliminated. full range of motion, no resistance. Alright, so now we're gonna be seeing if he can take a little bit more, so I'm gonna apply some minimal resistance. Alright, so now we're gonna see if the patient, I'm gonna stabilize again. Patient is gonna be with the arm abducted, externally rotated, elbow flexion, forearm in supination, and I'm gonna be palpating, stabilizing first the humerus, distal to the shoulder, proximal to the elbow. I'm gonna be observing and palpating for triceps right here. I'm going to be applying resistance distally, distant from the elbow, proximal to the wrist. Sir, please don't let me break you down. Okay, so that will be 2 plus. Full range of motion, minimal resistance, no gravity. Okay. Now we're gonna be doing 2 minus. Okay. So a patient is with arm abducted, externally rotated, elbow flex, elbow flexion, forearm supinated, and sir, can you extend your arm? Yes, right there. So that will be 2 minus, less than 50% movement, no gravity and no resistance, 2 minus. Alright, so the patient is going to be laying down on prone. This is elbow extension, no gravity, gravity eliminated. Patient is going to be laying down on prone. Arm is going to be abducted, externally rotated, forearm in supination. And we're going to be stabilizing the humerus, distal to the shoulder, proximal to the elbow. I'm going to be observing and palpating for triceps. And now I'm going to bring your hand up and then extend it, sir. And now all the way down. Okay, so I'm going to be feeling and palpating the triceps. Sir, can you touch your shoulder? And now extend your arm all the way out. So that will be 2 out of 5. Full range of motion, no gravity, and no resistance. Alright, so now I'm going to be applying some resistance with no gravity. Okay? I'm going to be stabilizing, observing, and palpating the triceps. Don't let me break you down. And that will be minimal resistance, 2 plus. No gravity, minimal resistance, full range of motion. Same process, stabilizing, observing and palpating the triceps. And now extend it. So less than 50% range of motion, no gravity and no resistance. That will be 2 minus. No twitch. Now there is a twitch. That will be 1 out of 5. 1 out of 5. And flaccid will be 0 out of 5. So that's elbow extension with no gravity. And again, the muscle that I was observing and palpating was the triceps. I was stabilizing the humerus, and that was elbow extension. And applying resistance in the distal part of the forearm. Proximal to the wrist, distal part of the forearm. We're going to do forearm supination with gravity. Patient is going to be sitting upright, shoulder is going to be adducted, elbow is going to be flexed, and he's going to be in pronation. We're going to be looking for this movement. When I ask you, just do this movement, full range of motion, arm is adapted. I'm going to be stabilizing the humerus, distal to the shoulder, proximal to the elbow. I'm checking for the supinators, but I actually gonna work for with the biceps too, observing and palpating the biceps. Sir, can you please bring your forearm and your hand all the way up? Turn your hand all the way up, and now down. Down. 3 out of 5. Against gravity, no resistance, full range of motion. And now I'm going to be applying some resistance in the distal part of the elbow, in the forearm, distal part of the elbow, and proximal to the wrist, but not in the wrist, in the distal part of the forearm. So, sir, please don't let me break you down. Okay, when I do this, I'm going to be, yes, so I can do this better. Shoulder adapted. I'm going to be stabilizing the humerus. First, I observe and I palpate the biceps. Sir, please don't let me push you down, okay? So, in the distal part, I'm going to be trying to bring the hand into supination. Don't let me. Alright, so now I'm going to be applying some resistance with gravity. Shoulder adducted, elbow flex, forearm is going to be in pronation. I'm going to be stabilizing the humerus, observing and palpating for the biceps. This is the supinators. I'm going to be applying resistance in the distal part of the forearm, proximal to the wrist, but not on the wrist. Sir, please don't let me break you down. Don't let me push you. Okay? In other words. Alright. So, 1, 2, 3. 3 plus 4, 5. So 5 out of 5. Patient didn't let me break him off, so that would be 5 out of 5 with gravity and maximum resistance. Alright, so now we're gonna see if he can do this with against gravity minimal. Okay. Alright, so same position, arm adducted, forearm pronation, elbow flex, biceps. Sir, can you try to do this movement? Show me. Alright, so yeah, change. So that's less than full range of motion, more than 50% against gravity in forearm supination. So that will be 3 minus. Alright, so now we're gonna do forearm supination with gravity eliminated, no gravity. You're gonna bring your arm here. So the shoulder is gonna be flexed, the elbow is gonna be flexed, and the forearm is going to be in pronation because we're going to be checking for forearm supination. So now we're going to be stabilizing the humerus, distal to the shoulder, proximal to the elbow. I'm going to be checking for supinators, but I'm going to be actually working with the biceps. Okay, I'm going to be observing and palpating the biceps while I am stabilizing the humerus. Observe and palpate the biceps. Now, sir, when I ask you, you're going to go and you're going to bring your arm into supination. So, at the count of 3, please rotate your arm, okay? 1, 2, 3. Okay, bring it back. That will be 2 out of 5. Full range of motion, no gravity, no resistance. Now we're going to see if he can take some resistance, and I'm going to be applying the resistance at the distal forearm. Okay? So, sir, please don't let me break you down. Alright? So, same procedure, elbow flex at 90 degrees, forearm pronated, shoulder flex. Stabilize the humerus, distal from the shoulder, proximal to the elbow. I observe and palpate the biceps. And now, please, sir, don't let me break it down. Okay, now this time I'm going to see if the patient can take a little bit more. So I'm going to apply some resistance. So shoulder flex, elbow flex, forearm supinator, forearm in pronation. I'm going to stabilize the humerus, distal to the shoulder, proximal to the elbow. I'm going to be observing and palpating the biceps, and I'm going to be applying resistance distal in the distal part of the forearm. So don't let me break it. Okay. 1, 2, 3. Alright. So that will be 2 plus full range of motion, no gravity, minimal resistance. Okay. Alright, so now we're going to see if we can take 2 minus. Alright, same process. So can you please rotate your hands? Alright, let's see. So that's no gravity, less than full range of motion, no resistance. Okay, so that's 2 minus. So now we're gonna be looking for 3 exercises. Stabilizing the humerus, observing and palpating the biceps. Sir, can you move your arm? Muscle twitch, I'm just looking for the muscle twitch. So that will be 1 out of 5. And then the arm very flaccid, that will be 0 out of 5. Okay, that's gravity eliminated. Alright, so now we're going to be working in forearm pronation. The patient is sitting in a right posture. The arm is going to be abducted. The elbow is going to be flexed at 90 degrees, and now the forearm is going to be supinated. So shoulder abducted, ADD, elbow flexed, and forearm is supinated. And now what I'm going to be doing is I'm going to be stabilizing the humerus distal to the shoulder, proximal to the elbow. Once I stabilize, I'm going to actually get in a better position. I'm going to feel for pronator teres on the volar aspect of the forearm. And once I feel for pronator teres, I'm going to be asking the patient to please rotate the hand. Okay, so I observe, I palpate, I stabilize. Sir, please, at the count of 3, you're just gonna rotate your arm normally. Okay, so 1, 2, 3. So that will be 3 out of 5. Okay. Now I'm gonna be applying some resistance to see if the patient can be a little bit more stronger than that. And when I apply the resistance, it's going to be distally in the forearm, proximal to the wrist, but distal from the elbow, okay? In the dorsal part. Okay, so sir, please don't let me break you down. Don't let me push you down, be as strong as you can. So shoulder adducted, elbow flexed, forearm is supinated. I stabilize the humerus. I'm going to be palpating, I'm observing from pronator teres in the volar aspect of the forearm. And now please sir, don't let me push you down, don't let me. I'm going to be applying the resistance in the distal part of the forearm, proximal to the wrist, distal from the elbow. Okay, don't let me push you down. So I'm going to be placing resistance. Don't let me push you down, sir. Okay, 1, 2, 3, 3 plus, no, 4, 5 out of 5. So patient, it's very strong. Okay, so that's against gravity. Now we're gonna do 3 minus. So more than 50% of the motion, but less than full forearm supination. Okay, so in this you guys gonna do. Okay. So we're gonna be doing adduction, elbow flexion, forearm supinated. I'm gonna be stabilizing the humerus, distal to the shoulder, proximal to the elbow, applying, observing and palpating for the pronator teres in the volar aspect of the forearm. And now I'm gonna see, remember, no, more than 50, less than 4. Okay, 4, 3 minus. Alright, sir, can you please flip your hand? Okay, so that will be 3 minus, 3 out of 5. Now we're gonna do this with gravity eliminated. So now we're gonna be doing forearm pronation with no gravity. So the patient is gonna be sitting, the shoulder is gonna be flexed to 90 degrees, the elbow is gonna be flexed to 90 degrees, and the arm is gonna be in supination. So, with no gravity, alright? So I'm gonna be stabilizing the humerus, distal to the shoulder, proximal to the elbow. I'm gonna be observing and palpating for pronator teres in the volar aspect of the forearm and the distal volar aspect of the forearm. Am I gonna be asking the patient to please bring to rotate his arm? So just flip your hand down, okay? So whenever I tell you, while I observe and palpate pronator teres. Can you please rotate your hamster, your forearm, and back. Okay, so that will be 2 out of 5 gravity eliminated. No resistance. Okay, so gravity eliminated, no resistance, full range of motion. 2 out of 5. Alright, so now we're gonna see if he can take a little bit more. I'm gonna be applying some minimal resistance. So shoulder is gonna be flexed, elbow is gonna be flexed, forearm is gonna be in supination. I'm gonna be stabilizing the humerus, distal from the shoulder proximal to the elbow. I'm gonna be observing and palpating pronator teres on the volar aspect of the forearm. I'm going to be applying some resistance in the distal part of the forearm, proximal to the wrist, distal from the elbow. This is going to be on the dorsal part that I'm going to be applying some. So, sir, don't let me break you down, pero si me dejas, okay? 1, 2, 3. Okay, so that was easy. 2 plus. Full range of motion, gravity eliminated, minimal resistance. Alright, so now we're going to see if he can do a little less than that. So shoulder flex, elbow flex, forearm in supination. So you're going to do less than 50%, okay? Just for the demonstration of the video, so I'm going to be stabilizing the humerus again. Observing and palpating for pronator teres. And sir, can you please do the movement? Okay, so less than 50% range of motion, gravity eliminated, and no resistance. That will be 2 minus. So now we're gonna be looking for trace, the twitch. So same thing. You just don't do nothing. Okay. I'm gonna be feeling for the muscle contraction for the twitch. While I stabilize, I'm observing and palpating, I'm stabilizing the humerus, I'm observing and palpating in the volar aspect, distal aspect of the forearm. Alright, so no más nada. So that's just the muscle twitch. That's 1, and now flaccid arm. Flaccid will be 0 out of 5. And that will be for arm pronation. Alright, so now the patient we're going to be doing shoulder flexion. The patient for this test is going to be just reaching to the shoulder level. You don't do nothing yet, I'm just explaining. The shoulder is going to be adducted, elbow flexed, and forearm in pronation. Okay. I'm going to be stabilizing the trunk above the shoulder, so I'm going to be stabilizing the trunk, and I'm going to be looking for the anterior deltoid just below the clavicle on the anterior aspect. So I'm going to be observing and palpating for the anterior deltoid right here while I stabilize the trunk above the shoulder. Sir, when I ask you, you're going to bring the shoulder just all the way up to your shoulder. You're going to be bringing your arm to the shoulder level, okay? Don't go higher than your shoulder level. Alright? So please, sir, can you bring your arm up? Right there. And now bring it down. Nice. So that will be 3 out of 5. Alright? Very good. Now he's going to be doing shoulder flexion again. I'm going to be applying some resistance. When I am applying the resistance, no, let me push you down, please. Don't let me push you, okay? Just keep strong. Okay, so I can demonstrate the steps. So, same process, shoulder adduct, elbow relaxed, forearm in pronation. I'm going to stabilize the trunk above the shoulder. I'm going to be feeling for the observing and feeling for the anterior deltoid. It's going to be in the anterior aspect of the body, right below the clavicle. Sir, I'm going to ask you to please bring your arm to your shoulder level again, right there. And please don't let me push you down. I'm going to be applying some pressure distal to the shoulder, proximal to the elbow. Don't let me push you down. You just look forward, sir. Okay. Don't let me push down. 3 plus, 4, and 5. So he's really, really very strong. 5 out of 5 against variety. Shoulder flexion. Alright, so now we're gonna see if you can take a little less. Same process, stabilize the trunk. I touch the anterior deltoid, observe, I'll palpate. Sir, can you please bring your arm up? No, un poquito menos. Un poquito menos. So that will be 3 minus, 3 minus. Less than full range of motion, a little bit more than 50%, against gravity, no resisted, 3 minus. And then we're gonna do 2 plus with resistance, so vas a ser less than 50% aquí, okay? So I stabilize the trunk, I feel and palpate, I observe and palpate for the anterior deltoid in the anterior aspect, right below the clavicle. Sir, can you please bring your arm? Less than 50%, right there. That will be 2 out of 5, less than 50% against gravity, no resistance. Okay. Alright, so now we're gonna be doing shoulder flexion with gravity eliminated, no gravity, and the patient is gonna be laying on side line, shoulder adducted, elbow relaxed, and forearm in pronation. So now, when I ask you, sir, you're gonna be lifting your arm just to the shoulder level. I'm gonna be stabilizing the trunk right here above the shoulder, and I'm gonna be feeling for the anterior, observing and feeling for the anterior deltoid and the anterior aspect right behind, below the clavicle, the line. Sir, can you please? Let me actually feel this muscle. Okay, can you please elevate your arm? Okay, now relax. That will be 2 out of 5. Full range of motion, gravity eliminated, no resistance. Now I'm going to be applying some minimal resistance. So I stabilize the trunk, I palpate and observe for the anterior deltoid, but now I'm going to let that go because it's not as important. Sir, please bring your arm up. And remember, me hace dejar un parte, okay? I'm going to be applying the resistance at the distal part of the humerus proximal to the elbow, okay? And you please let me break, don't let me break you down, don't let me break you down. So now we're going to be applying some resistance. Going to be stabilizing the trunk, observing and palpating more than anything, feeling the anterior deltoid. And then, sir, please bring your arm up. Right there, and now I'm going to be applying some resistance on the distal part of the humerus proximal to the elbow. So don't let me break you down, pero si me dejas. Okay, 1, 2, 3. So that's 2 out of 5. Some minimal resistance. He broke out after some minimal resistance. Okay, so that will be 2 plus without gravity, no gravity, minimal resistance. Okay, so now less than full. Alright, so now we're gonna see if the patient can continue doing with no gravity eliminated. I stabilize the trunk, observe and palpate for the anterior deltoid. Sir, can you please bring your arm up? Right. Alright, so that will be 2 minus, less than 50% range of motion, no gravity and no resistance. Ahora solamente es como un jerk, no mueves el brazo, okay? Solamente. Alright, so now we're gonna be looking for trace, twitch, stabilize, feel and palpate the muscle. Sir, can you please move your arm? Okay, so it's just a muscle twitch, that's trace, and then we're gonna see, relax, all flaccid, that will be 0 out of 5, flaccid, okay? So that's shoulder flexion with gravity eliminated. Alright, so now we're going to be doing shoulder extension. Patient is going to be on pronation. Bring your legs right here. Shoulder is going to be adducted, elbow relaxed, and the forearm in prone. Okay, so I'm going to be stabilizing the trunk above the shoulder area. I'm going to be stabilizing the trunk, and I'm going to be feeling for teres major, right below the axillary border. So, excuse me, just a second, please. Let go of it. Now bring your arm back to where it was. Okay, so I'm going to be palpating, observing and palpating the teres major right down the axillary border, stabilizing the trunk, okay? And when I ask you to move your arm, you're basically gonna do this, okay? You're just gonna bring it up, okay?
Okay.
Okay, so I stabilize the trunk. I'm gonna be feeling, I'm observing for the teres major along the axillary border. Sir, at the count of 3, I just want you to extend your arm the same way I just showed you, okay? So 1, 2, 3. So that's 3 out of 5. Very good. Now, since he's 3 out of 5, we're gonna see if he is stronger than that, and I'm gonna be applying some resistance at the distal end of the humerus. Let's see if he can tolerate that. Can you please lay down nice and straight? Yeah, but straight. Let me be straight. He had a pillow. I'm sorry, he's the patient, so he was a little uncomfortable, but we're trying our best. I'm gonna be, it's the same process, but with some resistance. I'm gonna stabilize the trunk right above the shoulder. I'm gonna be observing and palpating for teres major right down the axillary border. The arm is gonna be adapted, elbow relaxed for arm pronation. Can you please bring your arm up the same way you did before, sir? And now I'm going to be applying some resistance. Don't let me break you down when you do that, okay? So at the count of 3, I'm going to ask you to lift. I'm going to be applying some resistance. So are you ready?
Yes.
1, 2, 3. Up. 3 plus, 4, 5. And the pressure is in the distal side of the shoulder, proximal to the elbow. The pressure is right there. So it was 3 plus 4 and 5. 5 out of 5. Alright. Now, as I said, less than full range of motion, but more than half, okay, for 3 minutes. We're gonna see if he can take a little less than that. Gonna stabilize the trunk. I'm gonna be palpating for teres major. I'm gonna see if he can do teres 3 minus. Okay, let's go, sir. Right there. So that will be 3 minus, relax. Against gravity, less than full range of motion, more than 50%, 3 minus. Okay, now we're gonna be doing this without gravity. Alright, so now the patient, we're gonna be doing shoulder extension. Patient is gonna be laying down on the sideline. The shoulder is gonna be adducted, elbow relaxed, forearm impronation. We're gonna be stabilizing the trunk above the shoulder area. I'm gonna be observing and palpating for teres major, right down the axillary border. Please lift your arm right there. You can actually feel it, very nice, observing and palpating. Bring it down, please, there. When I ask you, you're gonna bring your hand all the way back, okay?
Yes.
On the count of 3. Okay, so I stabilize the shoulder. I'm gonna stabilize the trunk right above the shoulder. I'm gonna be observing and palpating for teres major right down the axillary border. And now, sir, at the count of 3, you're just gonna extend your arm back, okay? So 1, 2, 3. All the way back. So, okay, that's 3 out of 5. That's it, no compensate. Okay, so now we're gonna be applying resistance. Please don't let me push you down. Just hold strong as you can, okay?
Yes.
When you're gonna extend your arm and then you just hold strong, okay? So I'm gonna stabilize the trunk above the shoulder. I'm gonna observe, I'm gonna palpate for teres major, and it's right there down below the axillary border. Now, sir, I'm gonna please ask you to, at the count of 3, you're gonna bring your arm back, and then you don't let me push you down. Don't let me push you down. Sounds good?
Yes.
Okay, sir. So when he brings his arm back, I'm gonna be applying the resistance at the distal part of the shoulder, proximal to the elbow. Resistance distal part of the shoulder, proximal of the elbow. Alright, sir. Please bring your arm back, all the way back. Don't let me push you down. 3 plus, 4, and 5. Okay, so that's 5 out of 5 against
Against gravity.
no, estamos haciendo no gravity. Me equivoqué. Ok. Todo eso fue mal, todo.
Lo que. Lo que.
Porque tenemos que hacer tú. No gravity full range of motion resistant. Okay, so this one is the new one. Alright, so patient is gonna be laying side lying, shoulder adducted, elbow relaxed. For arm pronation, we're gonna be testing no gravity for shoulder extension. Okay, so first of all, I'm gonna be stabilizing the trunk right above the shoulder. For stability, I'm gonna be observing and palpating teres major right down the axillary border of the scapula, right down the axillary border, teres major. At the count of 3, sir, you're just gonna bring your arm all the way back, okay?
Okay.
1, 2, 3. Okay, now relax. That will be 2 out of 5. Relax. Okay, now I'm gonna be applying some resistance. I'm gonna see if he can tolerate. I'm gonna be applying. Don't let me break you down, pero si me dejas romperte, si me dejas empujar, te voy a aplicar poquito, okay? At the count of 3, you will do the same thing.
Okay.
So I stabilize the trunk. I feel and observe for teres major. At the count of 3, you're gonna bring your arm up, and you si me dejas empujarte un poquito, voy a aplicar, okay? 1, 2, 3. I'm gonna be applying the resistance at the distal of the shoulder, proximal to the elbow. 1, 2, 3. Okay. So minimal resistance. That's 2 plus no gravity, full range of motion, minimal resistance. So now we're gonna see if the patient can do less full range of motion. Okay, less than full range of motion. So vas a hacer, en vez de todo para atrás, solamente ahí, okay?
Yep.
So, same process, stabilization of the trunk, teres major, we know where it is, right down the axillary border. Can you please, sir, bring your arm back? Half right there, un poquito más. So that's 2 minus, less than 50%, no gravity, no resistance. Now we're gonna be looking for trace, and after that floor flaccid movement with gravity eliminated. Okay? So no haces nada con el trigo, okay? Stabilization, palpation of the teres major, stabilization of the trunk. Can you move your arm, sir? Just a little bit. So that's the twitch. I can actually feel the muscle twitch and right down the axillary border. Now, just relax. Flaccid arm, that will be 0 out of 5 flaccid arm for shoulder extension. Un poco más. Alright, so the patient, we're going to be testing shoulder abduction against gravity. Patient is going to try to sit upright. Shoulder is going to be adducted. Elbow is going to be relaxed. And forearm is going to be in neutral. Forearm is going to be in neutral. I'm going to be stabilizing the trunk of the patient. Above the shoulder area, I'm gonna be observing and palpating for the middle deltoid, right there. So I stabilize the shoulder, the trunk. Above the shoulder, I observe and palpate for the middle deltoid. And now, sir, at the count of 3, you're just gonna bring your shoulder up to your shoulder level, your arm to your shoulder level, okay? So I observe, palpate, I stabilize, observe, 1, 2, 3. Okay, bring it down. 3 out of 5 against gravity. Alright, so now what I'm going to be doing is I'm going to be applying some resistance in the distal part of the shoulder and proximal to the elbow. So the resistance is distal to the shoulder, proximal to the elbow in the humerus area. So sir, please, when I apply the resistance, do not let me push you down. Don't let me break you down. Okay, at the count of 3, you're going to do the same thing. I stabilize the trunk. I observe and prepare for the middle deltoid. Now, sir, please bring your arm up. And now I'm going to apply the resistance at the distal part of the humerus, proximal to the elbow. Don't let me break you down, sir. Don't let me push down.
No.
3 plus 4, 5. 5 out of 5. Okay, now we're going to see less than 3. So less than full range of motion, less than all the motion, a little bit more than 50%. Okay, so I stabilize. I'm gonna palpate, same process as before. So say, sir, try to leave your arm, a little bit more than 50%, right there, a little bit more. So that will be 3 minus, okay? Against gravity, no resistance added, more than 50% motion. And now we're gonna try to do 2 plus against gravity, so less than 50%, okay? So I stabilize the trunk, I observe and palpate menos del 50%. Right, 1, 2, 3, right there, that will be 2 plus against gravity. Less than 50% motion, no resistance added against gravity. Okay, so that's shoulder abduction. Okay, so now we're gonna be doing shoulder abduction with gravity eliminated. Shoulder is gonna be abducted, elbow relaxed, and forearm in neutral. I'm gonna be stabilizing the trunk above the shoulder. I'm going to be observing and palpating for middle deltoid. Sir, at the count of 3, you're just gonna bring your arm to your shoulder level, but to the side, okay? So I stabilize the trunk above the shoulder. I observe and palpate the biceps. I observe and palpate the middle deltoid. And now, sir, please bring your arm all the way up to the shoulder level. Right there, and now bring it down. So that will be 2 out of 5, gravity eliminated, no resistance, full range of motion. Now we're gonna see if he can take a little bit more. So I'm gonna be applying some resistance. Me dejas romperte fácil, minimal resistance, okay? Me dejas romperte fácil, fácil. Alright, so I'm gonna be stabilizing the trunk above the shoulder. I'm gonna be observing and feeling the middle deltoid. So please bring your arm up, right there. And I'm gonna be applying the resistance distal to the shoulder, proximal to the elbow, in the humerus. So I'm gonna go frozen, déjame empujarte, fácil, okay? 1, 2, 3, not tan fácil, un poquito fácil. Okay. So now I'm gonna be applying some resistance. I'm stabilizing the the trunk above the shoulder. Observe and palpate the middle deltoid. Now, don't let me break it out, sir, si me dejas, okay? Not tan difícil. I'm gonna be applying the resistance at the end of the shoulder, in the humerus area, proximal to the elbow. 1, 2, 3. Okay, so that's 2 plus, minimal resistance. Alright, so now we're gonna see what the patient can do. Stabilize in the trunk above the shoulder. Observe palpate the middle deltoid. Sir, can you bring your arm up? So that's 2 minus, less than full range of motion, no resistance, gravity eliminated. And now we're gonna be looking for trace. So, solamente el muscle twitch, solamente es así. Alright, so I stabilize the trunk, observe and palpate. Say, can you try to move your arm? So I just feel the twitch of the middle deltoid. And now the flaccid. Patient is too flaccid, 0 out of 5 for shoulder abduction. Thank you. Alright, so now we're gonna do shoulder external rotation. Patient is gonna be laying down on prone. The shoulder is gonna be abducted in 90 degrees. Elbow is gonna be flexed in 90 degrees, and the forearm is gonna be in neutral. So shoulder abducted, elbow flexed in 90 degrees, forearm in neutral. We're gonna be checking for shoulder external rotation. So what I'm gonna ask, I'm gonna be stabilizing distal to the shoulder, proximal to the elbow, the humerus. That's what I'm gonna be stabilizing. I'm gonna ask the patient to please bring his arm up. That's gonna be for external rotation. So I'm gonna be stabilizing the humerus again, as I said before. I'm gonna be palpating for teres minor at the end of the scapulary line, teres minor, okay? So, sir, please bring your arm down. So, let me just fix myself. I'm gonna be feeling for teres minor. I actually can feel it right now. And at the count of 3, sir, you're gonna be doing the movement that I asked you before. bring your arm all the way up, okay? When I count 3. So again, I'm palpating teres minor, and I'm stabilizing distal to the shoulder, proximal to the elbow, the humerus. So can you please bring your hand all the way up? Right there, the movement. And down. That would be 3 out of 5. Okay? Alright, so now we're gonna do the same process, but we're gonna be applying some resistance to see if the patient is a little bit more stronger. So same position, patient on prone, shoulder adducted, elbow adducted, forearm in neutral. I'm gonna be stabilizing the humerus, proximal to the shoulder. No, I'm sorry, distal to the shoulder, proximal to the elbow. I'm gonna be palpating for teres minor at the end of the scapular line. I'm gonna be asking the patient to please bring his hand up. Sir, please bring your hand up. And please don't let me break you down when I apply pressure. Don't let me push you down, okay? So I'm gonna be applying resistance at the end of the forearm, proximal to the wrist. Alright, so sir, please don't let me break you down, okay? 1, 2, 3. Plus 4 and 5. 5 out of 5. So, well, here in reality, let me break him down a little bit. So I will consider here a little bit more, 4 out of 5. But we try to get to 5. Okay? So now, sir, I'm going to be asking you to do less than full range of motion, less than all the movement, but more than 50%. Okay? So I'm going to be stabilizing, palpating. Sir, can you please bring your arm a little bit high, right there, a little bit more. So that will be 3 minus, alright? Relax. Okay. So now we're going to be checking for 2 plus. So solamente haces así, mira. Okay?
45.
Less, yeah, 45. Alright, so we're going to be checking for 2 plus with the patient. I'm going to stabilize again the humerus, distal to the shoulder, proximal to the elbows, palpating the teres minor right here. And sir, please do the movement. So that will be 2 plus. Against gravity, no resistance, less than 50% range of motion. Okay. Alright, so now the patient, we're going to be doing shoulder internal rotation against gravity. The patient is going to be laying down on prone. Shoulder is going to be abducted to 90 degrees for elbow flex to 90 degrees, and the forearm is going to be in neutral. This time we're going to be looking for teres major muscle. I'm going to be stabilizing the humerus distal to the shoulder, proximal to the elbow. I'm going to be looking for teres major at the end of this scapular line, teres major, right here. I can actually feel it. And now, sir, I'm going to guide your hand like this. When I ask you to 3, you're going to do that movement, okay, sir?
Yes.
I'm going to ask you. Alright, so I already mentioned the steps. Feeling for teres major, stabilizing here. At the count of 3, please, sir, move your arm down, okay? 1, 2, 3. Alright, so that will be 3 out of 5. Okay, so the following step is I'm going to be applying resistance at the end of the forearm. So we're going to continue with the steps. Okay, sir, don't let me break it down. When I push down, I'm going to be pushing right here, okay? At the count of 3, you don't let me do. So please bring your hand down. And now I'm going to be applying some resistance, okay? Don't let me break it down. 3 plus 4, 5. In this opportunity, I feel like he really broke down and been trying to do the movements. So I would say that he was also 4 out of 5. I'm not sure exactly if the goal of the video is to show each step, that's what I'm trying to show, but he really broke around 4 out of 5. I'm gonna continue with the steps just for the purpose of the video. Sir, so now you're gonna do the same process, less than full range of motion, but a little bit more than 50% movement, okay? So literalmente es ahí, ¿no? Porque ahí es todo, ¿no?
Oh, ok.
¿Hasta ahí llegaste antes o no?
Lo que pasa es que esta no es una cama profesional que yo sé cómo para...
Diego, no, no tienes que extender, tienes que doblar, así,
Ok.
¿ok? ¿Me escuchaste, no? Así.
Yeah.
So, entonces vas a hacer así, less than full, more than 50, okay? Alright, so we're gonna be looking for 3 plus. I'm gonna stabilize the humerus, distal to the shoulder, proximal to the elbow. Gonna be feeling for teres major right here at the end of the scapular line. Sir, can you please bring, do the moment more than 50, less than full range of motion. Like this, right there. So that will be kind for the video purpose like 3 plus, less than full range of motion, but a little bit more than 50%. Okay. Now we're gonna do 2 plus, so va a ser menos de 50%, 45, okay? So same process, feeling teres major, stabilizing the distal to the shoulder, proximal to the elbow. I'm observing and palpating the muscles every time that I'm doing the video. Creo que voy a tener que hacer because I didn't say I'm observing and palpating the muscles. Okay? ¿Me escuchaste? Okay. So vamos a hacer este, okay? Okay. Cuando haces el movimiento lo tienes que hacer así. La primera vez, okay? Y la segunda vez. Alright, so we're gonna be doing shoulder internal rotation against gravity. My patient is gonna be laying down on prone. Again, this is not professional math, but we have improvised, so he's a little uncomfortable. The shoulder is gonna be flexing 90 degrees. The shoulder is gonna be abducted in 90 degrees, elbow flex in 90 degrees. Forearm is gonna be in neutral. I'm gonna be stabilizing the humerus, distal to the shoulder, proximal to the elbow. I'm gonna be observing and palpating for teres major right here. It's a little difficult to observe, I'm feeling teres major. And now at the count of 3, sir, I'm going to ask you to please rotate your hand towards like your trunk, okay? 1, 2, 3. Alright, so that will be 3 out of 5. It's okay, relax. So 3 out of 5 against gravity. Now we're gonna be looking if the patient can do a little bit more. So when I ask you, you're not gonna let me push you down, okay? I'm gonna be pushing at the end of the forearm. So same process. I'm gonna stabilize the humerus, proximal to the distal to the shoulder, proximal to the elbow. I'm gonna be observing and palpating for teres major right here. Sir, please rotate your arm towards your trunk. The whole process right there. And a little bit right here, sir. Okay, and now I'm going to be applying resistance at the end of the forearm. Okay, so now let me break it down, okay? 3 plus, 4, 5. He kind of broke down. I'm trying to go through all the steps, but I would say he was more like a 4 out of 5 for shoulder internal rotation against gravity. The resistance was applying at the end of the forearm, distal to the elbow, proximal to the wrist. Okay? Alright. So now we're gonna be seeing if he can do 3 minus, which, you know, we're just trying to follow the steps, and then 2 minus. So for 3 minus, sir, you're gonna do more than 50, but less than full motion. Okay?
Okay.
Okay, so again, all the same steps, stabilize the humerus, distal to the shoulder, proximal to the elbow. I'm gonna feel, observe for teres major, and sir, do less than 50, a little bit more than 50% of the movement, if you can. Okay, so that will be 3 minus against gravity. Okay, relax, sir. No resistance. And now we're gonna see for 2 plus with gravity, so less than 50%, alright? So I'm gonna stabilize the humerus. I have already mentioned the steps. I'm gonna be palpating and observing for teres major. Sir, can you please do the movement? Alright, so that will be 2 plus out of 5, less than 50% against gravity, no resistance. Okay, right. Alright, so now we're gonna do shoulder external rotation with gravity eliminated. The patient is gonna be sitting, the shoulder is gonna be adducted, the elbow is gonna be flexed at 90 degrees, and the forearm is gonna be neutral. So shoulder adducted, elbow flexed, and forearm neutral. So we're going to be looking for shoulder external rotation. What I'm going to be doing first is I'm going to be stabilizing the humerus, distal to the shoulder, proximal to the elbow. I'm going to be looking for teres minor at the end of the axillary border of the scapula, right here. Now, sir, at the count of 3, I'm going to ask you to bring your arm like that.
Okay.
No, ¿cómo es? No. Que tú no miras los movimientos.
Oh, it's like this.
Okay. Okay, let's do that. Alright, so now we're going to be doing shoulder external rotation. Like that. Now we're going to be doing shoulder external rotation. The patient is going to be sitting with the shoulder adducted, elbow flexed at 90 degrees, forearm in neutral. I'm going to be stabilizing the humerus, distal to the shoulder, proximal to the elbow. I'm going to be palpating for teres minor at the end of the axillary border of the scapula. I'm going to be asking the client to please, like this. No, like this, so I don't get in his way. Okay, sir, I'm observing, I'm more palpating than observing the muscle. Sir, can you please bring your arm all the way out, like that, and good, now in. So that will be 3 out of, okay, 2 out of 5, okay, one more. Alright, so we're going to be doing shoulder external rotation with gravity eliminated. Patient is sitting, shoulder is adducted, elbow flexed at 90 degrees, forearm in neutral. I'm going to be stabilizing the humerus, distal to the shoulder, proximal to the elbow. I'm going to be observing and palpating for teres minor along the axillary border of the scapula. In order for the patient to be able to move better, I'll observe and touch, but more actually touch. Teres minor, and now sir, please bring your arm all the way out, your hand out, and in. Okay, so that will be 2 out of 5. No gravity, no resistance, full range of motion. Alright, so now we're going to see the patient can take a little bit more. I'm going to be applying some resistance. Don't let me push you down, pero si me vas a dejar empujarte. Fácil, bien fácil. No tan fácil, pero bien fácil. Alright, so we'll do the same process. Stabilize the humerus, distal to the shoulder, proximal to the elbow. Again, I'm going to observe and palpate for teres minor more than anything palpate. Okay, so when my client goes all the way out, I'm going to be applying the resistance. Me dejas romperte, okay? Okay, pero suavecito. Lo voy a hacer para allá. I'm going to be applying the resistance at the end of the forearm, distal to the elbow, proximal to the wrist. Okay, suavecito, me dejas romperte, okay? 1, 2, 3. Okay, so that's, I'm trying to demonstrate 2 plus out of 5. Minimal resistance, full range of motion, and gravity eliminated. So now we're going to see if the patient can do 2 minus. I'm going to feel less than 50. Okay? Alright, sir, can you please try to do the movement? Right there. Alright, so that will be 2 minus, less than 50% range of motion, no gravity, no resistance. Now, solamente te quedas ahí. Okay? Alright, te voy a preguntar que lo hagas, pero no lo haces. Don't do it. Alright, so I stabilize the humerus. Every step that I repeated before, I observe and palpate for teres minor along the axillary border of the scapula. Sir, less than 50. now we're gonna be looking for twitch. So, no, that right there, let's see. So the twitch of the muscle, right here on the teres minor is what I'm looking. Try to do the movement, sir, try. Okay, so I kind of feel the contraction, that will be twitch, 1 out of 0, and then if the patient is very flaccid, it will be, the other one was 1 out of 5, I'm sorry, I'm gonna slow down. And then if the patient is very flaccid, that will be 0 out of 5. External rotation against gravity. Okay, so now we're gonna do the same thing, but for internal rotation. Alright, so now we're going to be doing shoulder internal rotation with no gravity. Patient is going to be sitting in the same position, shoulder adducted, elbow 90 degrees, forearm in neutral. I'm going to be stabilizing the humerus distal to the shoulder, proximal to the elbows. This time I'm going to be palpating and observing for teres major along the axillary border of the scapula. Teres major. For the comfort of the patient, I can actually feel it more than see it, teres major, but for the comfort, I'm gonna actually touch here because it's uncomfortable. Sir, when I count to 3, you just bring your arm all the way in, your forearm and your hand when I count 3. Alright, for internal rotation with no gravity. 1, 2, 3. And now come back. So that will be 2 out of 5. Full range of motion, no gravity, no resistance. Now I'm going to be applying some resistance, minimal resistance, to see if the client can do so. Now your arm is going to be there. I'm going to be trying to pulling you down, okay? So same thing, I'm going to stabilize the humerus, distal to the shoulder, proximal to the elbow. I'm going to be feeling, kind of observing for teres major, and here along the axillary border of the scapula, which is right here in the back, actually, right here, along the axillary border of the scapula, teres major. Okay, so teres major is right here, along the axillary border. Okay, so alright, we're gonna be doing shoulder internal rotation. This time we're gonna be having the patient going the hand all the way in. I'm gonna stabilize, don't do it yet, sir. Patient sitting with shoulder adducted, elbow flex, forearm in neutral. I'm gonna stabilize the humerus, distal to the shoulder, proximal to the elbows. I'm gonna be observing and palpating for teres major at the end of the scapula line, the axillary border of the scapula. I'm sorry. So I'm gonna ask you, sir, at the count of 3 to please bring your hand and your forearm in towards your tummy. 1, 2, 3. And now bring it out. So that will be 2 out of 5. While I was observing and palpating for the muscle, the patient the movement. So I felt the muscle and the patient was capable of doing the movement, so that will be 2 out of 5. Now we're going to be applying some resistance. Your hand is going to be here. Me vas a dejar romperte fácil, pero no tan fácil, pero mínima resistance. Alright, so same process. I'm going to stabilize the humerus, palpate, and observe for the teres major muscle. I'm going to, now that the patient is in position, I'm going to try to break him down. Me dejas romperte fácil, pero no tan fácil. I'm going to apply minimal resistance, me dejas no tan fácil. Okay? So at the end of the forearm, distal to the elbow, proximal to the wrist, that's when I'm going to be trying to take him out. 1, 2, 3. No? Okay. So that will be 2 plus out of 5. Minimal resistance, gravity eliminated. Of course, he was full range of motion. Alright, so now we're going to be doing 2 minus, stabilizing the humerus distal to the shoulder, proximal to the elbow, observing and palpating for teres major, the end of the axillary border of the scapula. And sir, you're gonna try to do the movement for me, please. Right there. Alright, so that will be 2 minus, less than 50%, no gravity, no resistance. Now we're gonna be feeling for the twitch, which is number 1, and following by flaccid. Alright, so patient sitting in the same position. I'm gonna be definitely observing and palpating for teres major at the end of the axillary border of the scapula, stabilizing the humerus, distal to the shoulder, proximal to the elbow. You just kind of, okay? 1, 2, 3. Let me actually feel the muscle. Try to bring your hand down in, but your forearm in, but don't try to bring it in. Okay, I felt it now, so that will be twitch of the muscle, and now, yes, right there. I mean, if the patient doesn't have any control, that will be flaccid. 0 out of 5. For shoulder, internal rotation with gravity eliminated. Again, I was observing and palpating for teres major. I stabilize the humerus, distal to the shoulder, proximal to the elbow. Okay, thank you. Alright, so we're going to be doing wrist extension with radial deviation. The patient is going to be sitting with the forearm resting over the table in prone position. The hand is going to be on neutral and the fingers are going to be relaxed. I'm going to be stabilizing over the mid of the forearm. I'm going to be finding extensor carpi radialis longus and extensor carpi radialis brevis over the second and the third metacarpal at the end. Okay, so first GG, second, third. So I'm gonna be applying feeling for that in between. Second D, third D. So right here, sir, I'm gonna be asking you to please extend your hand up towards your thumb. Okay, so that will be a little bit more, 3 out of 5. Okay, and now I'm gonna see if the patient can take some resistance. I'm gonna be applying resistance over the second and the third metacarpal towards flexion. Okay, so I'm gonna be applying resistance. Sir, don't let me break you down. I stabilize on the mid of the forearm. Sir, please pick up your hand towards your thumb, and don't let me break you down when I apply resistance over the second and the third towards the ulnar side. Don't let me push you down for real. Okay, 3. I'm gonna be playing with 3. That was 3 plus 4 and 5. 5 out of 5. All right, now we're gonna try to do this full range of motion. No, I'm sorry. We're gonna do 3 minus. It's gonna be less than full range of motion, but more than 50 with no resistance. So I'm gonna stabilize the mid of the forearm and hand in the same position. Sir, can you please try to do this movement? All right, that will be kind of 3 minus, less than 50%, less than full range of motion, more than 50%, no resistance. 3 minus against gravity. Y luego así. Yes, así. Yes, así. Okay. And now we're trying to show, we're gonna show 2 plus against gravity. All right, so I stabilize in the mid of the forearm. I'm gonna be looking for at the end of the wrist, second and third metacarpal for ECRL and ECRV, and patient is gonna be going into radial side. Okay, try. So the can less than 50%, that will be 2 plus out of 5. All right, so now we're gonna be doing wrist extension with radial deviation. The patient is gonna be sitting with the forearm resting on the table in mid position over the ulnar side with the fingers relaxed in a neutral position. I'm gonna be stabilizing the mid forearm, and I'm gonna be asking the patient to please try to extend his fingers while before I observe and I palpate for sternosol carpi radialis longus and sternosol carpi radialis brevis at the dorsal side of the metacarp and in between the second and the third digit. So I'm observing and palpating. The count of 3, sir, please, you're gonna just deviate your hand Okay, 1, 2, 3, right there. So that will be 2 out of 5. Okay, so now we're gonna see if the patient can take some pressure. So I'm gonna be applying minimal resistance. Don't let me break you down. Okay, so I'm gonna be applying the resistance over the dorsum of the second and the third metacarpals towards ulnar flexion. So I'm gonna be applying the resistance over the second and third metacarpal going towards ulnar. Okay. All right, sir. So the count of 3. While I'm gonna stabilize the mid forearm, I'm gonna be observing and palpating for ECRL and ECRV at the between the second and the third metacarpal. Now, sir, please try to bring your hand up. And now I'm gonna be applying resistance. Don't let me bring you down, okay? All right. So that's kind of 2 plus minimal resistance. He took it, and now he's just gonna be doing like this, right? For 2 minus less than 50% movement. Okay, so I stabilize in the middle of the forearm. I'm gonna observe and palpate for ECRL and ECRV between the second and the third metacarpal. And sir, try to do the movement. Okay, so less than 50%, that will be 2 minus. Now we're gonna be observing for the twitch. So just kind of, so this is just a twitch. That's 1 out of 5, and then very flaccid will be 0 out of 5 for stellar wrist extension. We're gonna be doing wrist flexion with radial deviation against gravity. Patient is gonna be sitting down. The forearm is gonna be supination, the wrist in neutral, and the fingers relaxed. I'm gonna be stabilizing over the mid forearm. I'm gonna be observing and palpating for flexor carpi radialis at the base of the second metacarpal. Observing and palpating. Now the patient is gonna be flexing his hand radially like this, and that will be 3 out of 5. That was 3 out of 5. Patient was able to fully flex towards the radial side. And now I'm gonna be applying some resistance, and the resistance is gonna be towards extension in ulnar deviation between the second and the third metacarpal. All right, so I'm gonna be stabilizing on the forearm. I'm gonna observe and palpate at the base of the second metacarpal. Now, sir, when I apply the pressure, please don't let me break it down. Please bring your hand up, flexion. Okay, I'm gonna be applying resistance over the second and the third metacarpal. So don't let me break you down towards the ulnar part. 3 plus 4. Don't let you fall. 5. So he didn't let me break him down, so that will be 5 out of 5. All right. So now we're gonna see if the patient can do this less than full range of motion, but more than 50% for 3 minus. I'm gonna stabilize in the mid forearm. I'm gonna observe and palpate at the base of the second metacarpal for flexor carpi radialis. Now you're gonna do less than full range of motion, but more than 50, so a little bit right there. So that will be 3 minus with no resistance at. And now we're gonna be changing to wrist flexion with radial deviation, but no gravity. Okay? Okay. So now the patient is gonna be sitting. The forearm is gonna be resting on the table. His hand is gonna be towards the ulnar border. The wrist is gonna be in neutral, and the fingers are gonna be relaxed. I'm gonna stabilize over the mid forearm. I'm gonna be observing and palpating for the flexor carpi radialis at the end of the second metacarpal. 1, 2, right here. And now I'm gonna be asking the patient to deviate his hands in a flexion way. So you're gonna be doing like this, right?
Okay, it is.
Like that. All right. So please, sir, you're gonna be flexing your hand out of the table, please. Okay. So without gravity, full range of motion, I'm flexing the hand out of the table with no resistance. That will be 2 out of 5. Now, patient is gonna complete the same movement, and I'm gonna be applying some resistance. So I'm gonna be stabilizing over the mid forearm. I'm gonna be observing and palpating for flexor carpi radialis at the base of the second metacarpal. Now, don't let me break you down when I apply the resistance. Do the same movement you did before, sir. And I'm gonna be applying the resistance towards extension and ulnar deviation. Okay, so please don't let me break it down. So over the base of the second and the third metacarpal. Okay, so that will be 2 plus. Minimal resistance with no gravity. Okay, so now, sir, you're gonna be trying to do less than 50% just to show the purpose of the assignment. So I'm gonna be stabilizing over the mid forearm. I'm gonna be observing and palpating for flexor carpi radialis at the base of the second metacarpal. Sir, you're gonna try to do the same movement but less than 50%. Okay, right there, that will be 2 minus, less than 50% movement, no gravity, no resistance. Now we're gonna be observing for the twitch for number 1. Okay, so yes, no, don't do it. Just like that. Okay, so I'm gonna be stabilizing the forearm. I'm gonna be palpating. I'm observing for flexor carpi radialis at the base of the second metacarpal. Sir, can you please try to move your hand? Right? So the twitch of the muscle, that will be traced. And now if the hand is really very flaccid, that will be 0 out of 5 with no gravity. Okay. All right, so now we're gonna be doing MCP flexion with the forearm on the table on supination. The wrist is gonna be in neutral, and metacarpal is going to be extended and the IP is going to be flexed. So we're going to be working with the second finger. Metacarpal is going to be extended, IP flex. Again, can you please get closer? Okay, so again, patient is going to be sitting, forearm is going to be resting on the table in supination in a neutral position. The MP metacarpal is going to be extended, IP is going to be flexed. I'm gonna be stabilizing proximal to the metacarpal joint, so basically on the wrist side, so it doesn't move. In the palm of the hand, I'm gonna be observing and palpating. I'm gonna flip the hand a little bit for a second. I'm gonna be observing and palpating for the dorsal interosseous, just medial to the distal aspect of the second metacarpal. So right there, I'm observing and palpating. When I'm doing that, I'm gonna bring the hand to the same position. I'm gonna be asking the patient to please flex this part of your finger. Just flex. Yeah, flex all the way down. Okay. Can you please flex? Alright, so that will be 3 out of 5 against gravity. Now I'm gonna be applying some resistance between the metacarpal and the PIP towards extension. So I'm gonna be applying here the resistance when the patient flexes towards extension. So don't let me break you down, sir. Okay, so please bring your finger up the same way. Don't this one in extension, this one in flexion. Just bring it there. And don't let me push you down, sir, okay?
Alright.
I'm gonna be applying resistance in the metacarpal, between metacarpal and PIP. So right here on the second Okay, so I'm gonna be applying resistance 3 plus. Don't let me break it out. 4 and 5. 5 out of 5. All right, so let's see if the patient can do 3 minus. So less than full, okay?
Okay.
Range of motion. So I'm gonna be stabilizing proximal to the metacarpal joint of the hand. I'm gonna be stabilizing here. I'm gonna be observing and palpating for the interosseous muscle again, and I'm gonna ask the patient to do less than full range of motion but more than 50% flexing. So right there, so that will be right there.
Mm-hmm.
That will be like 3 minus. Against gravity, no resistance. All right. Metacarpal and PIP. Eso es el PIP, ese es el metacarpal. Okay. Now we're gonna be doing this with no gravity. So the patient is gonna be sitting with the forearm towards the ulnar side. The fingers are gonna be relaxed, and the wrist is gonna be neutral. I'm gonna be stabilizing proximal to the metacarpal joint of the palm hand, right here over the wrist. I'm gonna be observing and palpating for the interosseous muscles, just medial to the distal aspect, medial. So this will be distal and this will be medial. Observing and palpating to the medial aspect for the interosseous muscle. Patient is gonna have this extend and this flex. And I'm gonna ask the patient to please flex the finger like that. Okay, while I observe and palpate, while I stabilize over the metacarpal joint on the wrist. Okay, so in the medial aspect, I'm gonna be feeling for that between the second digit. Please, sir, flex your finger, just like that. So that will be 2 out of 5 with no gravity. Now I'm gonna be applying some resistance between the metacarpal and the PIP joint towards extension. So I'm gonna be applying some resistance here. All right, so now we're gonna be doing PIP flexion. Patient is gonna be positioned in a sitting, forearm resting on the table, in supination with the wrist in neutral position and the the MP extended and the IP extended. I'm gonna be stabilizing between the metacarpals and the PIP joints. And we're just gonna be doing the second figure. Gonna be stabilizing here between the metacarpal and the PIP joints. I'm gonna be palpating for flexon digitorio superficialis on the volar surface of the proximal phalanx. I'm gonna be palpating there, and now I'm gonna be asking the patient to please flex. You're gonna be flexing your PIP and your DIP, so they both are gonna be flexing. PIP and DIP. So you're gonna be flexing the finger right there, and then that will be, while I'm palpating, I'm observing, you just flex, that will be 3 out of 5. Can you please be awake? 3 out of 5. Okay, so I am stabilizing and I'm palpating for flexor digitorio superficialis. That will be 3 out of 5. Now please don't let me break you down. I'm gonna be applying resistance with the PIP and the DIP. So I'm gonna be applying resistance here in between while I stabilize the metacarpal and the PIP joints. I'm gonna be applying some resistance, and let me break you down. I'm gonna be applying in between PIP and DIP. So don't let me break you down, sir. Okay? Can you please keep your eyes open? So 3 plus 4, 5 against gravity. Okay? Now we're gonna be doing this with gravity eliminated. Oh, let's do 3 minus. So you're gonna be doing, patient is gonna be with the forearm supinated, wrist neutral, fingers gonna be MP and IPX is gonna be stent. Now I'm gonna be stabilizing between the metacarpal and the PIP joint proximal to the phalanx, and I'm gonna be feeling for palpating for flexor digitoris superficialis on the volar surface of the proximal phalanx. Now I'm gonna ask you to please flex your PIP and your DIP. Flex while I feel that. But your hand, okay, it's wrong. Okay, so we're gonna be doing PIP flexion against gravity, with no gravity. All right, so we're gonna be doing PIP flexion with no gravity. So patient is gonna be with the forearm in neutral, wrist in neutral. Fingers are gonna be Alright, so we're gonna be doing PIP flexion with no gravity. Forearm is gonna be in neutral, the wrist is gonna be in neutral. We're gonna be stabilizing between the metacarpal and the PIP joint in the second digit. So I'm gonna be stabilizing right here between the metacarpal and the PIP joint. I'm gonna be palpating for flexor digitorium on the volar aspect of the hand. And now I'm gonna be asking the patient to please flex the PIP and the DIP joint. Sir, can you please flex while I stabilize the MP and I am palpating the flexor digitorum superficialis? Can you please flex right there? So that will be 2 out of 5. Now we're gonna see if the patient can do the same thing while I stabilize the MP and the PIP joints on the proximal phalanx. I'm stabilizing here. I'm gonna be observing and palpating for the flexor digitoris superficialis on the volar aspect of the second phalanx. And sir, can you please flex your PIP and your DIP? Flex like this. Flex it. And now flex it. Keep it there.
Okay, well,
I'm gonna be applying resistance between PIP and DIP into extension. So that will be 2 plus. Minimal resistance. Now, patient is gonna try to do the same thing, 2 minus, while I stabilize over the MP and the PIP joints. I'm gonna be observing and palpating for flexor digitoris superficialis on the volar aspect of the second phalange, and do less than 50% movement with your PIP and your DIP, sir. Do less than 50%. Okay, so that will be 2 minus. Then try to move your finger, sir. So I just gonna feel for the muscle twitch, and that will be twitch 1 out of 1, and then the finger very flaccid will be 0 out of 5. Okay. The forearm is gonna be resting on the table in supination. The wrist is gonna be in a neutral position. MP and PI and IP are gonna be extended, or PIP, MP and PIP. All right. So what we're gonna be doing is I'm gonna be stabilizing between the PIP and the DIP joint. I'm gonna be stabilizing right here between the MP and the PIP. I'm gonna be stabilizing right there. PIP and PIP right there. I'm gonna be palpating for the flexor digitoris profundus right here between the PIP and the DIP. I'm gonna observe and palpate for the flexor digitoris profundus, and now I'm gonna observe the DIP, which is the last joint. Flex. Sir, can you flex your finger, your thumb? Not your thumb, your DIP. Can you flex the DIP? Just keep it up. Alright, so that will be 3 out of 5. Alright, don't move. Now I'm gonna be applying some resistance when you do only move this part, the DIP of your finger, okay? So I'm gonna be stabilizing between the MP and the PIP. I'm gonna be observing and palpating for flexor digitorio profundus. I'm observing and palpating. So can you just flex your DIP? And don't let me break it out. 3 plus, 4, 5. That's 5 out of 5 with gravity. Okay, and now really 3 minus is a little hard to do, but he's gonna try to flex. So I'm gonna be stabilizing between PIP, MP and PIP. I'm gonna be observing and palpating for flexor digitorio profundus, and now try to do less than 50. More than 50, but less than full range of motion, kind of difficult, but that will be 3 minus. Okay, now we're gonna be doing the same thing, but with gravity eliminating. Forearm is gonna be a neutral, wrist in neutral, and fingers relaxed. I'm going to be stabilizing between the PIP and the DIP right here on the second digit. I'm gonna be observing and palpating for flexor digitorio profundus. Sir, can you please, you're gonna be doing this movement, okay? Can you please flex the DIP? All right, so that will be 2 out of 5. No gravity, no resistance. All right, and now we're gonna be seeing if he can take a little bit more. So sir, when you flex, I'm gonna be applying minimal resistance, okay? So I'm gonna stabilize with the MP and the PIP. I'm gonna be observing and palpating for flexor digitorio profundus. And now I'm gonna be applying some resistance in here. When you flex your finger, flex it right there. Yes, the DIP. Yes, the DIP, sir. Please open your eyes. I'm gonna be flex it. Flex that part. Okay. So. Oh no. So we're gonna be applying the resistor station. All right. So my God. All right. So now we're gonna be doing with minimal resistance. Okay, minimal resistance. So forearm in neutral, wrist in neutral. I'm gonna be stabilizing between MP and PIP. I'm gonna be observing and palpating for flexor digitorio profundus. Now, sir, please flex your DIP and don't let me flex it like this. Don't let me break you down, okay? 1, 2, 3, minimal resistance, so that's 2 plus, and now without resistance, he's gonna be trying to do less than full range of motion. Okay, so I stabilize between MP and PIP. I observe and palpate for flexor digitorio profundus. Try to flex. Okay, so less than 50, so that will be 2 minus. And now I'm gonna be feeling for the muscle twitch for 1. So I'm gonna be stabilizing between MP and PIP. I'm gonna be observing and palpating flexor digitorio profundus, and now try to twitch. To do this but not do it, so I'm feeling for the twitch in the muscle. So that will be twitch 1 out of 5, and now very flaccid, that will be 0 out of 5. Gravity eliminated, no resistance, and very flaccid 0 out of 5. Working with the hands, it's a little complicated. I have done my best. I am not planning to be a hand specialist. But I have tried my best.